Hello, everyone. I'd like to welcome you to today's webinar, United Nations Research Roadmap for the COVID-19 Recovery, Leveraging the Power of Science for a More Equitable, Resilient, and Sustainable Future. We're excited to have a great speaker here with us today, but before we begin, I wanted to note that there will be an opportunity for questions and answers later. Please use the chat to ask your questions or share comments during the presentations. Also, if you have any feedback after today's event, please email us at covidn@mcmaster.ca. Our speaker today is the Director of the Global Strategy Lab and Scientific Director of the CIHR Institute of Population and Public Health, amongst many other titles. Stephen Hoffman's research leverages various methodological approaches to craft global strategies that better address transnational health threats and social inequalities. Some of his past studies have focused on access to medicines, antimicrobial resistance, health misinformation, pandemics, and tobacco control. But before I pass it over to him, I'd like to introduce Maureen Dobbins, who will provide a brief introduction to COVIDN.
Thanks very much, Steve. So it's my pleasure to tell you a little bit about COVIDN for if there's anyone that's joining today that is unfamiliar with COVIDN. I'm doing this on behalf of myself and Lawrence Langer, who is the co-lead of one of 7 working groups that's part of COVIDN, the Engaging Working Group. So just a little bit about what COVIDN is. This is a time-limited network that came together really quickly upon the start of the pandemic. So by April of 2020, Dr. John Lavis and Dr. Jeremy Grimshaw met and pulled together a group that are interested in helping support the response to COVID-19. And really it started with those that were supporting decision makers on COVID-19 to be able to use the best available scientific evidence, and also to help researchers to avoid waste by reducing duplication, trying to coordinate the many evidence syntheses that were happening, as well as look at methods for the evidence syntheses in a crisis. The partnership grew to more than 50 organizations around the world that either pre-COVID were world-leading evidence synthesis groups or technology assessment and guideline groups. And it covers the full spectrum of the pandemic response, from public health measures to treatment to social systems and economic responses. And they, John and Jeremy, worked really, really hard to ensure that there was good representation from both high income and low and middle income countries. Next slide, Steve. And really just a quick look at the logos of the many organizations. This is all available, of course, on the COVIDN website to learn more about all of those that have been partners in COVIDN. And if you want to know more, there are several ways to find out more. Of course, you can go to the COVIDN website. It's listed there. There is an inventory of best evidence syntheses for public health measures, clinical management, health systems arrangements, and the economic and social responses. And this is an incredible inventory that a huge amount of work has gone into assessing thousands of evidence syntheses that have been done since the pandemic began, finding the best of those that are answering the most pressing questions that have occurred during COVID and putting those in one spot. And it's something that you can search as well. There's also horizon scans for emerging issues. So groups that have been thinking about what's on the horizon and the results of those discussions are there. And then there's also the community to support decision makers. So this is the engagement working group that Lawrence and I have headed up. We created an online community called the COVIDN Community. There's over 300 members now, and we host discussions several times a month to really discuss methods and learnings in the work that we've been doing to support decision makers. And if you would like to sign up for the listserv, you can see the link there. And then there's also a living hub of COVID-19 knowledge hubs. And you can see here, if you'd like to learn more, you can email covidn@mcmaster.ca, and we're also on Twitter. And just in terms of our acknowledgements, there have been many that have contributed to making COVIDN a reality, including the government of Ontario that used some in the early days funding that was available for a different project that was put on hold early in the pandemic, supported COVIDN, as well as the National Institute of Health Research, as well as individual donors, and then also a grant from CIHR. And with that, we'll now pass it over to the main event, to Stephen Hoffman.
I see. I first have to unmute and then I have to share, so I can do it. First, let me just give a big thanks to COVIDN and to you, Maureen, for the really kind introduction, and to others. This presentation today, I'm very much looking forward to. This is part of an effort that I was asked to lead, or invited to lead, by the UN Deputy Secretary General, related to how do we recover better from this terrible event that we've all experienced over the last 18 months. And so today my goal is very much to give an update about this work, where it came from, why it was important, what we did to develop this UN research roadmap for the COVID-19 recovery. The document itself is published. It's on the UN's website, available for all to read. But I'm going to give a bit of a summary of it in the hope that maybe it'll pique some folks' interest in diving further into it, and indeed actually seeing how does it affect your own work, whether you're a researcher, whether you're a student, whether you're a policymaker or a civil society leader or working in industry. This research roadmap was very much intended to be helpful across all sectors of society. And at the end, I'm looking forward to a conversation with those who are here joining live in order to think through how this, what this means for a better recovery and how we go forward. So with that in mind, and I hope everyone can see my slides, the starting point is very much that, yes, this is a pandemic of a virus that has spread to all corners of the world, but this is also a pandemic of socioeconomic consequences. It's been a pandemic of inequities. And in that respect, yes, there is a virus that we need to address and there's immediate medical implications of it, but I think everyone around the world has also experienced, even those who have not had this virus themselves or their family members, have still experienced massive, and in some cases, unprecedented consequences. For example, early projections showed that in the year 2020, 71 million people were pushed into extreme poverty. School closures at one point affected 90% of students in the world. In some countries, domestic violence cases increased by 30%. And then 60% of countries reported prison overcrowding, which of course is itself not good, but then also not good in the context of a pandemic and the way the way this virus spreads. And so as a result, when we're thinking of the COVID-19 pandemic, yes, this is a pandemic of a virus, but this is a pandemic that's threatening progress and has actually caused quite a lot of progress on the Sustainable Development Goals to retract. And so that's a problem, one that of course needs an equally strong socioeconomic response to the medical response. And in the UN's wisdom, this was not something that was a surprise to the UN. And so it was only a few months after this virus was first identified that the UN actually rapidly brought together and published a UN framework for the immediate socioeconomic response to COVID-19. This was, again, out of recognition that this virus was going to cause all sorts of downstream consequences, and that the United Nations and its member states needed to be ready to address those socioeconomic responses, those socioeconomic consequences with responses. The immediate socioeconomic recovery framework identified 5 pillars for action. The first on health services and systems, the second on social protection and basic services, the third on economic response and recovery, a fourth on the macroeconomic response and multilateral collaboration, and fifth on social cohesion and community resilience. All of that to say is that in April 2020, at the very beginning of this pandemic, there was already a sense of some immediate actions that could take place. But we also knew, and again, in the UN's wisdom, recognized that just because there are actions that can already be taken to address these socioeconomic consequences that would come and that were already starting to be shown, we needed to make sure that this response was a learning response, one that got to take advantage of lessons learned earlier in the pandemic in order to inform responses later on. In other words, a test of whether this pandemic's response is a good one is partially on the basis of, was the response later in the pandemic different and more informed than it was earlier on, because we've learned through research and systematic knowledge generation. And so with that, there was this idea, and the UN Deputy Secretary General invited this idea of developing a UN research roadmap for the COVID-19 recovery. Essentially, the goal was to turn that existing UN Socioeconomic Recovery Framework into a learning initiative. There were 4 specific objectives: ensure that recovery could be informed by the best available research evidence. Second, to support learning from early responses to inform later responses. Third was to bring renewed focus to those systemic issues that we've long known about, that have been problems for a long time, but for which COVID-19 proved to be a grand revealer, particularly those issues that affected those populations facing the greatest conditions of marginalization. And fourth, it was really about trying to enable international scientific collaboration through having a unifying global framework. That was the objective and the background context. What did we actually do? Well, for that, we were given 10 weeks. So remember, the pandemic, everything was rapid. We needed something quick. Many countries were looking for support to figure out where do the top priority knowledge needs need to be, and where should research funders be making investments. And so in 10 weeks, we launched a rapid process. We did the best that we could. What we did is we brought together 5 steering groups, which consisted of 38 research funding agencies from 25 countries, bringing together a whole lot of meetings to ensure a meeting of the minds and that we could steward this process in a good way. We then engaged 270 experts through written submissions, through virtual consultations, through key informant interviews. We also commissioned 5 rapid scoping reviews that have since been published in peer-reviewed journals. But in addition to those scoping reviews, we accepted written submissions. We hit, there was over 10,000 records that were reviewed or that were found in our searches, 320 studies included in those scoping reviews, all of which came together in 10 weeks through a lot of late nights and weekends in order to develop this research roadmap. And ultimately, what this process all did was really emphasize one thing, which is that the socioeconomic recovery from COVID-19 not only is needed to address all the challenges that we've all collectively experienced, some experiencing, of course, far worse than others, but actually it is a huge opportunity to achieve the kind of transformational changes that we've all sort of known are needed in our world, but for which sometimes a crisis provides an opportunity to achieve those kind of changes that are desperately needed. And so this whole framework is really about how do we, through the power of knowledge, through the power of science, how do we get to that better future that we've long known is needed, but for which sometimes a focusing event like a crisis, like a pandemic, can provide that spark when it's informed by research evidence to get us where we need to go. And for that, then ultimately what this research roadmap does is it prevents a choice, essentially. And it's a choice between business as usual or those kind of transformative changes that I was just speaking about. And I guess the advantage of business as usual is that we know where it's going to get to. And actually, we don't need to do that much work. We don't need new research in order to figure out how we get there, because we know how it was. We just go back to the way things were. The big downside with that, though, is we know the outcome. And that outcome, I think most people would agree, was deeply dissatisfying in the sense of how unequal our world is, how unsustainable we are, how unresilient we are to future disasters and crises that will inevitably come. And so instead, what, as the visual on the slide sort of tries to impart, Instead, this research roadmap highlights that a better choice would be not business as usual, but actually would be transformative changes, trying to get to a more equitable, resilient, and sustainable future. The challenge then is that we don't fully know how to get those transformative changes and what they need to be. We have a very strong sense, and certainly we don't need to wait for more research to already take action. But because we have never been there, we don't fully know what's needed and how to properly implement and how to ensure that everyone gets to benefit. And so as a result, when we don't know something, of course, the first place we need to turn to is research. And so in that respect, yes, we have a response, we're going to have a recovery. Research then becomes an essential ingredient to getting us to where we want to get to in the future. And so for that, what the roadmap does is the final sort of document that's now been published. It identifies the top 25 research priorities spread across those 5 pillars of the UN Socioeconomic Recovery Framework. Specifically, it's the 5 top research priorities for each of those 5 existing pillars. We also provide a framework for understanding the challenges and opportunities that lie ahead. And towards the end of the framework, we point towards 5 science strategies that are needed to ensure that we can actually take advantage of science to fuel a better recovery. And so I'm going to quickly walk through these, although the full details are in the document itself. And I do want to make sure to leave lots of time for discussion and questions. So I mentioned 25 research priorities. Now, I won't go through them all. I will highlight what some of them look like in a couple of slides. But I first want to emphasize that if I was asked to summarize, and indeed in the documents, when we're sort of challenged and when we do summarize, what are these 25 research priorities all about? I'll say that they're all really ultimately about serving a single overarching question, which is how can COVID-19 socioeconomic recovery efforts be purposefully designed in order to not only achieve the immediate goal that those recovery efforts are trying to achieve, but also stimulate greater equity, greater resilience, and greater sustainability so that we can achieve the Sustainable Development Goals by the 2030 deadline. Essentially, this framework, this research roadmap for the COVID-19 recovery is offering a co-benefits framework. It's acknowledging that there will be efforts in every country around the world as part of a recovery from this pandemic. Let's make sure those recovery efforts are not only achieving the specific goals they're trying to achieve, but that there's a lens of trying to achieve co-benefits to enhance equity in society, to enhance resilience, to enhance sustainability. And this is intended in that respect to be a universal framework because every society could make improvements for equity. Every society could be more resilient. Every society desperately needs to become more sustainable. And so this is a way of thinking about and identifying knowledge needs that actually do transcend all sorts of geographies and contexts. And then, of course, then require different jurisdictions, different contexts to think about how to take this home and adapt it for their own contexts and circumstances. So I'm not going to go through all the 25 research priorities, but I will sort of put them on the screen, highlighting that, for example, and I'll give some examples. So within the health systems and services pillar of the UN Socioeconomic Recovery Response Plan, one of the key questions was really around how can we ensure that health systems are engaging communities, building trust, and supporting collective responses to emerging health threats. I think today this question becomes obvious when we think, for example, about vaccination rates for COVID-19. A lot of challenges in terms of vaccine uptake in every part of the world. And so, of course, trust then, this was identified sort of when, well, this was identified all a year ago, but certainly today it becomes clear why that kind of effort is important, including at a time when health systems are under unprecedented stress and when some of the traditional means of building trust, of engaging people are limited because of the need for physical distancing. Second, as an example within social protection and basic services, there is this key question that we need, for which we need research, is around how can necessary social protections be made available to all people when they need them. The crises, emergencies like this pandemic have showed that a whole lot of our social protections around the world, they break down when there's an emergency, when the normal systems of governance and operation no longer become things that we can rely upon. So how do we design, basically, how do we bake in resilience into our social protections in ways that means that they're there when they're most needed? Third, in terms of this category of economic response and recovery, one example is around, it was 3.5, around how have recent economic changes disproportionately impacted women, and how can recovery strategies be inclusive and gender transformative? This priority was very much based on the reality that women are facing disproportionate consequences of this pandemic. A lot of it has to do with the traditional roles that women have filled or been forced to fill in different jurisdictions around the world, and how those gender norms and social norms are then disproportionately impacting what women are expected to do, and the broader follow-on consequences that women have faced during this outbreak. Of course, everyone has faced consequences, but it's very clear that there's been a disproportionate impact on women. How do we ensure that then recovery efforts are, yes, recovering and supporting everyone, but ideally are actually tackling those underlying social structures that continue to discriminate against women in every society around the world? Fourth, areas around macroeconomic policies and multilateral collaboration. Lots of great conversations and lots of good ideas. One I'll just highlight is around how have recent global shocks, whether it's the pandemic, but also other issues, how have they affected the functioning and legitimacy of international institutions? I think this is important because in the light of the COVID-19 pandemic, it really highlights the extent to which we're all in this together, and how we have these risks that are shared and that defy national boundaries, such as the fact that viruses don't carry passports, and we can't keep them out by asking them to stay away, or by building, no matter how big of a wall some countries might want to build, the viruses are going to come in because people and products are coming in and moving in a hyper globalized world in which we live. And so people are seeing very in a visceral way the need for international cooperation, for international institutions. Yet these shocks at the same time actually affect the way those international institutions function, and actually can undermine their legitimacy. So how have they affected, and how do we actually strengthen these modes of international cooperation that are increasingly needed as our world becomes a smaller place? And just as a final example, this is within the social cohesion and community resilience pillar. And this example is around how can digital technologies be harnessed to promote social cohesion while ensuring no one is excluded? And for me, this one was a little bit of a surprise, in the sense that I knew from my own context in Canada that digital technology was certainly being used in a big way to mitigate the consequences of this pandemic. For example, virtual learning, moving schools and students going online, along with their teachers and faculty, workplaces going online and such. But of course, what really surprised me through this process was how much that focus on digital technologies was relevant for every jurisdiction in the world. Of course, it looks very different. This question means different things in different contexts, but that digital divide that we've seen during this pandemic, where some have been able to continue their activities, others not, really highlights this need to overcome the digital divide, or else we're going to actually find ourselves in a far less equal world on top of the already very unequal world that we have always been in. An important area for all jurisdictions. So those are my examples. I think that another way of thinking about this co-benefits framework is by thinking about a quadruple bottom line from recovery efforts. And that's what this figure is intended to show. So first, this figure is trying to highlight that, yes, solutions that achieve their direct benefits, they're great, and we're happy with those. But not as happy is if we can also achieve one co-benefit, such as equity. Even better would be solutions that governments and non-government organizations and industry and others implement that achieve two co-benefits, like adding resilience. And even better would be a recovery that achieves its direct benefits as well as these three co-benefits. And the way I'm going to emphasize why this is important is because our societies, when we think of these co-benefits, on one hand, we can think of it as additive, but actually they're all very dependent on each other and we need all of them. We can't just pick one or two. We actually need all three. And for this, I'm just going to put forward this image of a three-legged stool. Our recovery, and a good recovery, depends on a more equitable, a more resilient, a more sustainable world. If we don't have one of them, like if we don't have resilience, then we just are going to be waiting for the next crisis, the next disaster, and then the whole system collapses again. I don't think that's a place we want to be. Certainly, we need research to ensure that we don't get there. And so just as I go towards the end of my presentation here, did just want to hone in on then that final part of this research roadmap and what it's intending to do, which is really to emphasize the power of science and how we need to make investments in science and scientific infrastructure and broader processes around science in order to make sure that all societies can benefit from this enormously powerful approach to generating knowledge and solving problems. And so with that, we identified in this research roadmap 5 science strategies. The first is around the need for robust data infrastructure. This is a challenge in the poorest countries in the world. This is a challenge in the richest countries in the world. What kind of data infrastructure do we need across societies in order to ensure that we're able to make data-driven decisions? A challenge everywhere, although of course the challenge looks different everywhere. Second is around implementation science. This research roadmap highlights that it's not enough to study and know what works. We also have to study what works for whom and in what contexts, and how do we actually promote the uptake of effective interventions after they've been adapted to the unique context in which they're trying to be implemented. That's a key sort of thrust of this research roadmap, and one that we took the opportunity to highlight as the need for all societies and all scientific institutions to be thinking about. Third was this idea of rapid learning systems. And this is really just based on the idea that we need to shorten the period from which we have knowledge and from and to which we then act on that knowledge. And ideally creating iterative and closer and shorter loops of feedback in order to ensure that we're constantly able to benefit from learning that's happening. It's not easy, but there certainly have been pioneering efforts, including those that are being acted upon and promoted by COVIDN and all the partners who are involved in the network. Fourth is around knowledge mobilization. This is about ensuring that we don't just have knowledge, we make sure that we take concrete action and have evidence-informed strategies to make sure that that evidence can make a difference. And fifth, related to all of this, is then about a science of science. You know, if this research roadmap is serious about calling on all governments, NGOs, industry to make use of science to inform their actions, then scientific systems themselves have to inform what they do with a robust science. And so that includes, for example, taking a scientific look at how is research funded? How is it practiced? How is research evaluated? How do we build research cultures that are excellent, that are inclusive, that are equitable, that are efficient, that are open, and that serve the needs of people around the world? I think then we'll just hone in on sort of in my final parts. It's clear that this framework, it is just a document, but it's intended to not just be a document. It is a call for action. It's a call for researchers to try to tackle these priority questions. It's a call for research funding agencies to invest in answering them and support their research communities. It's a call on governments and civil society organizations to ask for this research, demand it, support it, and ideally institutionalize the use of research in decision-making processes. And so for that, what we're doing is, yes, we published this research roadmap. We continue to disseminate it throughout the world. One thing that's been great is we're starting to see research funding agencies actually have special calls focused on the priorities identified in the research roadmap. We're starting to see conversations with UN agencies and international research entities about how do we institutionalize these processes. And then one thing that we've done is working with GLOPADAR and the UK Collaborative for Development Research, we're actually tracking how much funding has been invested according to these 25 top-level research priorities that were identified in the research roadmap, such that a few months from now, we'll actually be able to report back, here's where investment has been made, here's where investment has not been made, and where we need further research activity. So with that, just wanting to acknowledge, I'm delighted here to share this work, and it was really quite an honor to have been asked to lead this effort. But of course, any process like this done in 10 weeks, done with in this kind of a way, is a collaboration. Yes, it was very much a collaboration across Government of Canada, coming together, doing everything it could. It was also a collaboration, though, involving so many UN, it was over 20 UN agencies, involving the network that brings together research funders internationally around infectious diseases, involving the International Science Council, and actually it was 38 research funding agencies from all over the world that were involved in our steering groups and contributing all sorts of supports to make this whole process happen. So with that, let me thank COVIDN again for this opportunity to present about the UN Research Roadmap, and looking forward to discussing with everyone. Thank you very much.
Great. Thanks very much, Stephen. That was a wonderful presentation. Let me just start off by reminding people that if you have any questions for Stephen from this presentation and his work, please do ask your questions in the chat, and then we'll address them in the Q&A period now. If you're interested in the UN research roadmap for the COVID-19 recovery, I did share the link to the full document in the chat as well. So if you haven't already had the chance to read it, I would encourage that you do so after today's webinar. We had one question that came in, Stephen, that was whether people would be able to access the slide deck from the presentation.
Yes, there is a slide deck that's been posted on the Canadian Institutes of Health Research's website. So I will send that link. I'll post it in the comments, and then Steve, maybe when the recording of this webinar gets posted live, maybe that link can also be shared in the notes along with it, so that anyone listening afterwards can also access it.
Sure, that sounds great. I'll add that link to our webinar page so that people can see the presentation as well as the recording from today's webinar, which we'll post there as well. We have another questions from Asha. So first of all, she said, thank you very much for your time today. She has two questions, actually. So what barriers have you faced for accessing high quality research and data that is representative of rural populations in low and middle income countries, where rigorous health administrative data is often not available? And then finally, how do you and your team envision tackling the translation of this amazing work you're doing in Canada and beyond?
Great. Yeah, thanks, Asha. Thanks so much for joining today and for your great questions. So the first one, this is a real challenge. We do not live in a data equal world. We live in a very inequitable world. And part of the challenge in trying to address those inequities is that we don't have data that is representative of everyone who we need to serve and who needs to be part of these decision-making processes. And that problem, though, just to emphasize, I think in particular, I think you're correct. The problem is particularly bad in rural populations, or facing rural populations in low and middle income countries. But actually, I will just want to emphasize this is a problem in Canada too. For example, we do not have data that reflects our entire Canadian population. A lot of the work that needs to be done, for example, engaging with Indigenous populations, whether on reserve or not, but also around people who have been facing all sorts of discrimination from governmental systems or the healthcare system, who there's historical practice of abusing data that has been, in some cases, forcibly taken from people, naturally breeding concerns around future data that's being done. So I think this is what you're highlighting is a huge challenge. One, though, that isn't as simple as, of course, just starting to try to collect the data. It's really about working with communities and ensuring community ownership of data systems and ensuring that people see value. And there's a commitment that when we identify then inequities that this data is then made use to actually address them and not just stop with seeing that we have problems. In terms of your second question, yeah, thanks. We need your help. We need everyone's help to translate this work into action. I think a lot of our efforts to date have been focused on supporting research funding agencies to make investments that are linked to the research roadmap. This work, the theory of change there, of course, being that if this work can influence what gets funded, or sorry, what funding is, what calls kind of get put out, then that would influence what research gets funded. It would then influence what knowledge could be generated and ideally then made use of afterwards. So I think in short, I should have just said, we need everyone's help to make sure this work gets translated. So please do spread the word and think about how this work affects your own work in your own context. Thanks, Asha.
Great. And then Anita asked whether there are any discussions about using common measures to compare gains in the co-benefits.
It's a great question. When we were developing the research roadmap, at the beginning, part of our plan was to try to develop some common metrics that would allow us to say, okay, a year later, have we made progress? Are the issues that we were worried about and for which we identified knowledge needs, are those issues getting better or worse? In the end, what we decided not to include sort of a metrics framework. It was for two reasons. The first was because we had to do all this work in 10 weeks because there was this sense that it was urgent to get this out fast in order to align global activities in this space. But also because we recognize that any kind of metrics framework that we develop would really just be borrowing or duplicating the frameworks already available to monitor progress on the Sustainable Development Goals. And so in that respect, the metrics, the common measures to figure out whether we are achieving gains and having a better recovery, a more equitable, more resilient, more sustainable recovery, they're all found in the Sustainable Development Goals monitoring framework. They haven't been pulled out. We didn't do the work to pull it out and hone in on which ones, but in a sense, we decided that because this work is really all about trying to achieve the Sustainable Development Goals, if this work is able to inform progress on those metrics, then that's what this was all about. And then we'd view that as a success.
Great, thanks. So Maureen said, thank you for your presentation and just said that the work is outstanding. Her sense is that national funding agencies need to collaborate on funding mechanisms and asked if you could comment on whether there are any efforts underway that would involve multinational level funder opportunities.
Yeah, so there have already been some funding opportunities that were launched. The first one was an effort from the Transatlantic Partnership for Social Sciences and Humanities. This is a network of, it's over 20 social science and humanities research funding agencies on both sides of the Atlantic, in both the north and south of the Atlantic Ocean. So in that respect, that was one of the first ones where they invited international research teams, so North America, South America, Europe, and Africa, to put forward calls that were responding to the UN research roadmap. We know several other funders have done the same, several European funders, non-governmental funders. There's quite a large call in Brazil that was launched following up on the research roadmap priorities. We do know that there are additional funders that are still bringing things together. And so I'd encourage folks to just keep an eye out for those funding calls, which I think are key to enable this kind of work. But of course, there's also other funding opportunities that are not specific to the framework, to the research roadmap that I think should be taken advantage of. For example, in the Canadian context, so I work at the Canadian Institutes of Health Research half-time, and every 6 months there's a project scheme funding opportunity that accepts project proposals on the full range of health research. All of the 25 research priorities identified in this framework would be eligible for that work if one links it to health outcomes, and all of them are essential and key for health outcomes. Our hope is that publication of this research roadmap gives sort of one more justification in support of those researchers when they're applying for grants, being able to refer to that they're actually responding to the UN Research Roadmap. And hopefully peer reviewers see that as yet one more reason to be taking a very close look at that grants application.
Great. Now, I know you've already mentioned that you want everybody, would encourage everybody to get involved and help out in this work. But Maureen also asked whether, I guess, for researchers that may not have experience and expertise in these 25 priority areas, but would like to get involved in future projects, what suggestions do you have for them to get connected to others already working in those areas?
Yeah, that's a great, it's a great question. I think that's, first of all, I would say that the 25 priority areas, they are broad. They're purposely broad in the sense that they had to be both addressing the full range of the socioeconomic consequences of the pandemic. So this pandemic has affected everything. So as a result, those priority areas do cover a broad range of efforts. So in that respect, if there are researchers who do want to act on them, I think our hope is that there is a way that researchers can leverage their expertise and their existing work to put it in the direction of where this roadmap is trying to point us. But I think the other is linking up to one's research institutions, different society, academic academies, different societies who have been, many of whom have been trying to bring interdisciplinary teams around trying to solve these challenges. And I think that linking up and putting ideas forward to the different academies, for example, or sending emails and requests to funding agencies, or initiating conversations at one's own universities or teaching hospitals, could find that there's actually lots of interdisciplinary opportunity here to make progress. And sometimes having this kind of external effort that was done as a official UN process does help to bring people around a common goal. And so if that helps coalesce new interdisciplinary research teams that are where the members are able to take full advantage of their expertise, networks, their resources, that for us would be a key win. It's ones that we don't hear as much about because it happens more organically, but it's one that I have already seen actually happen in at least a few places, and ideally something we'd like to see more of.
Great. Just one other quick thing to add to that too is through COVIDN, we have a community listserv. So I've seen some examples of that before where people discuss ideas for research or things they might be considering. So that would be something else where people could, either suggest research that they're interested in doing or look for opportunities to, join in or partner with other groups that are doing similar stuff as well. So to your point of the organic kind of research. Sumalatha also asked, comment and question. She said that she thinks that we need a lot of community level involvement in low and middle income countries to overcome the cultural barriers, to overcome the stigma against COVID-19 and the way patients are treated by society. And that she compares the, COVID has become kind of the new HIV illness in that respect. So she asked what your recommendations on these issues and and the stakeholders already involved in low and middle income countries.
Yeah, that's a great, Simula, that's a great question. When people ask me what are the key themes that emerge when you sort of look at these 25 research priorities, what are some key themes? The two that I always sort of go to in reacting is first, gender, and second is community empowerment. So your question about community involvement to combat cultural barriers, overcome stigma, I think it's exactly what we need to be thinking about. And that was very, very present during the conversations around the development of this research roadmap. I would say that the roadmap itself does not offer a prescription on how to do this, but it does prescribe that it has to be done. And it does prescribe that we need research to actually figure out how to do this well, including, if not especially, during emergencies. One thing I live in one of the wealthiest countries in the world, yet I found I was a little surprised during the pandemic context that a lot of the existing systems for democratic engagement, for community engagement, didn't happen during the pandemic. And I think on one hand, I think it's because a lot of the mechanisms that we've long depended upon for that kind of community engagement, like face-to-face meetings, town halls, in-person events and things, were no longer possible. But actually, when we're all facing a crisis, this is exactly when we need that engagement most. And I think we've learned a lot during this pandemic. I think we've learned a lot about why we need to think about these things in advance. I mean, we all knew a pandemic was going to come at some point. I remember it was just a few years ago, we were celebrating or noting the 100-year anniversary of the Spanish flu. And so that opportunity of highlighting that a once in a century event is overdue was in many places not taken as that call to action. So it wasn't actually the opportunity that it could have been to mobilize and think about, how do we do things like communities? How do we build trust? How do we ensure that there is social license to respond to these kind of outbreaks? Because I think one thing that we know is that a good outbreak response is going to be one that the community has trusted and that has the participation of communities. And I think a lot of our blunt instruments that we have available to address pandemics require and depend upon communities to comply. And of course, if communities aren't trusting and weren't involved in the decisions and in the planning, why would they have that level of trust or social license, even in a country like my own in Canada, that has some of the highest rates of trust in government and social license? That can't be depended upon to remain in a long-term pandemic. So in any event, I think I didn't answer the question. I'm more explaining why I agree with you that it's so important, and emphasizing that the thrust of the question was very much present, or we tried to make it very present within the research roadmap. And I think it's a key area for research because we don't actually yet have the answer.
Great. How interested do you think governments in Canada, federally and provincially, how interested are they in addressing the issues identified in this report? And if they are not interested, how do you suggest that we get this on their agendas?
Yeah, so I think the good news is they are. Of course, every democratically elected government in Canada is going to have a different approach. And that's whether those approaches are good or not. Citizens get to decide at election time. But it seems like every government in Canada, whether it's federal, provincial, territorial, municipal, regional, are all thinking about a recovery and what this means for their own jurisdictions. I think that unlike other kinds of health threats, I think one good thing, it's good and bad. I mean, the good thing is that there is, I think, now greater awareness around that we live in a very unequal society. I think the fact that they were able to show those maps of who is getting COVID, who is getting vaccinated and such, highlights the very unequal Canada in which Canadians live. And so and if I'm saying that's good is because it's brought to the fore. It's been that grand revealer for the fact that governments in Canada cannot just implement policies and actions that work for the average. We actually are needing concrete actions that reach everybody. And actually, it's in everyone's benefit to see that happen. I mean, there's lots of discussion now about adequate housing. There's discussion about sick leave. There's discussion about income supports. There's discussion about sustainable environments and what kind of cities we want to live in. And it's those kind of discussions, I think, have been accelerated by the very obvious and unacceptable inequities that have been not caused by, but that have been deepened and revealed during this pandemic. So what governments actually do with that, of course, it's going to look different depending on the unique circumstances of that jurisdiction, depending on the values and preferences that governments are responding to. But all governments are talking about recovery and are trying to think about how to do it in a good way for their citizens. That's an opportunity. In Canada, it's an opportunity everywhere in the world.
That's great, Stephen. That's certainly encouraging to hear that that's your that's the experience you've had. Governments are interested in trying to make the best of the situation and use this research roadmap, hopefully, to try and address some of those challenges. So if anybody does have more questions, I would encourage you to ask them in the chat now. Actually, no, there is another one that just came in. So Asha asked if during the synthesis of the roadmap and the identified priority areas, that there was any concern that the focus on this pandemic would overshadow more chronic and systemic health challenges worldwide. And if you and your team were able to incorporate those to create a comprehensive plan. That's a great question.
Yeah, thanks, Asha, again for that question. You know, in many respects, this research roadmap and its focus on the socioeconomic consequences and the socioeconomic recovery from COVID was actually a strategic effort to overcome the COVIDization of everything. In that respect, what we did is, yes, we used the pandemic as our jumping off point and the consequences that it caused and the long-standing issues that it helped illuminate for many people who hadn't previously seen it or experienced it, in order to chart a better future that would get us towards achieving the sustainable development goals. So it itself was actually an attempt to ensure that the broader range of social structures and factors and goals that we have in our society extend beyond just not getting COVID and recovering from COVID, right? It's about, by recovering from COVID, I mean the virus itself and the disease it causes. So that for us was at the core of the mission. I too sometimes worry about the COVIDization of everything. And I think we will need to continue to guard against that while simultaneously mounting the kind of robust response that this ongoing pandemic requires. I think some things that I'm hearing already is that some people are ready to kind of get back to the way things were. This pandemic continues to spread globally. Most people in the world have not been vaccinated. They haven't had access. There's serious disparities in being able to make use of these kind of technologies and other approaches to protecting people from the brunt of this pandemic. So this is not going away fast. And so we need to be sophisticated enough to continue a response to this pandemic while simultaneously recovering from it, while simultaneously advancing the many other goals that we're trying to achieve. And I do think the Sustainable Development Goals does give us a unifying framework to do all of these things at the same time. The key is we need to take it seriously and keep on reminding ourselves about those longer, broader goals.
That's great, Stephen. Obviously, there's a lot of these ongoing issues. I do think that one of the, and to me anyways, one of the interesting parts in your scientific response, the slide that you had, was the rapid learning element, because I think, with COVID, I think in particular, it showed us just how quickly some of these situations changed and how quickly our knowledge evolved. So I think that trying to ensure that that element is built in, so that if, whether it's COVID or something else that comes about and changes the way that we, as a health system, have to deal with things, as a social system, we deal with things, that we can learn, and it's not just a fixed solution that's there forever, but that we can try and address it and then learn from that. So whether it works or not, we have a response, and then can adapt to try and make it better so that we continue learning and improving. So
yeah, I agree. I think, Steve, that I think that's a really powerful concept, the idea of rapid learning systems. And I was really pleased that we were able to incorporate that into the UN Research Roadmap. It's where you're based at the McMaster Health Forum, you guys are at the leading edge of thinking about this. In the UN Research Roadmap, the document cites the McMaster Health Forum's report on rapid learning systems. So if folks want to dive further into that, that's an amazing resource that was brought together by the McMaster Health Forum. I think that we somehow need to figure this out. There's this stat that's always cited about how a healthcare innovation takes 17 years to go from the innovation to its deployment. We know in many other different areas that those kind of gaps that are there, it's not as simple as spreading the word about these innovations, right? There's systems that have designed structures and processes and accountabilities and incentives that mean that encourage, unfortunately, status quo bias, or that cause resistance to change. And so I think what's really powerful for me about that concept of the rapid learning system is that it highlights that it's not just about working harder, it's about designing systems that allow us to work smarter, recognizing that we will be able to unlock a whole lot of value and impact if we're able to design our systems in a way that shorten the time frame between when we are able to know something or have insights to when we can actually implement them.
Great, thanks. We're getting close to the end of our time for today's webinar. So before we wrap up, Maureen, did you have any last comments that you'd like to share?
Thanks, Steve, and thanks, Stephen, as well. This has been absolutely an amazing hour and absolutely incredible work. And I mean, 10 weeks, I can't believe you did all that in 10 weeks. You must have needed a few days of sleep after that, but really inspiring to see this work. And my mind is spinning. I'm sure everyone who's on the call, their mind's spinning about, you know, what we can do individually, how to mobilize our teams, and really be a part of something to really try to get the change that you're talking about. So really inspiring. And thank you so much for joining us today.
Thanks so much for having me.
Yes, thanks. Thanks again, Stephen, and thanks everybody for joining today's webinar. As I briefly mentioned before, a recording from today's session will be made available on the COVIDN website, and we'll share it through Twitter as well. So I would encourage, for those of you who were able to attend, share it with others who may not have been able to. And you know, if you have any questions or comments about today's webinar, you can always email us at covidn@mcmaster.ca afterwards, and we'll do our best to try and address those as well. So thanks again, Stephen, for a great presentation, and we'll talk to you soon, I'm sure. Thanks, everybody.
Bye.